Okay.
Let's begin. The baroreceptor. What is the meaning of the baroreceptor? Baro means
Pressure.
pressure. Receptor that detects pressure changes. Right?
Yes.
Yes. There is another receptor that is known as chemoreceptors. Chemoreceptors. The chemoreceptor detects change in chemicals, gases, right? Okay. So baro or chemoreceptor are present at carotid sinus and aortic arch, right? This is aortic arch. So what is a carotid sinus? The carotid sinus is basically the dilated area superior to the bifurcation of carotid arteries, right? So baroreceptor and chemoreceptor are present in aortic arch, right? And carotid sinus. So they either detect the pressure or chemical changes. So so these receptors, baroreceptor mainly, carries detects the pressure changes, right? Detect the pressure changes. They detect the pressure changes and send the signal to the medulla. This is medulla, particularly the nucleus tractus solitarius. The nucleus in the medulla is tractus solitarius, right?
Yes.
From the aortic arch, from the aortic arch, the signal are transmitted to the tractus solitarius through the vagus nerve, which is the cranial nerve 10, right? And from the carotid sinus, these pressure changes signal sent by glossopharyngeal nerve, which is the cranial nerve 9, to the nucleus tractus solitarius, right?
Yes.
So from the nucleus tractus solitarius, these signals send efferent signals through sympathetic fibers and through the parasympathetic vagus nerve, right? So system, parasympathetic nerve increase heart rate, increase blood pressure, increase cardiac output. While the parasympathetic or vagus nerve decrease heart rate, decrease heart rate, decrease blood pressure, opposite. Okay, I have scenario for you. So the USMLE love to ask this kind of the question from the students. Like if there is a massive hemorrhage, massive blood loss, massive blood loss, massive blood loss lead to decreased blood pressure. So this decreased blood pressure is detected by the baroreceptor, right?
Yes.
Massive blood loss lead to the decreased blood pressure, and this blood pressure is detected by baroreceptor. And these baroreceptors send signal to the medulla, nucleus rectus solitarius, and this nucleus send efferent signal through parasympathetic vagus nerve and through sympathetic nerve. Okay. If there is a decreased blood pressure, right? So what will efferent medulla send efferent signal? That decrease the decrease the parasympathetic activity, right? Decrease parasympathetic firing or activity and
Sympathetic.
increase sympathetic
Sympathetic.
activity, right?
Yes.
To restore the blood pressure to the normal, right? Does it make some sense?
Yes. Yes.
So USMLE asks the question, giving the canonical winner. They give you a scenario, long clinical winner, where they give you a patient from the road traffic accident where the massive blood loss. So there is a decreased blood pressure, right? So these kind of things. And they ask you what kind of changing take place, right? Decrease parasympathetic activity, increase sympathetic activity, right? So some sort of the in arrow form, right?
Right.
So again, hypotension give rise to activate this. Okay. Can anybody tell me the what is a posture hypotension?
Yes, it's like when a
When
person
a
rises,
person suddenly rises,
orthostatic, and then sudden rise and the blood pressure drop.
Sudden
Orthostatic
rise in a
hypotension.
postural hypotension. Postural hypotension. Okay. This is a clinical condition. First, we discuss the physiology, right?
yes,
Physiology, normal physiology, right? So, when a person from the postural hypertension, from which posture to which posture? Hello?
from
Yeah.
sitting to standing posture or lying to standing posture.
Okay. So, from sitting to standing posture. So, what does the standing do?
Standing
Kick off.
decreases the
Standing do
There will be
cooling
venous
of the
pooling
blood,
from standing.
decreases
venous cooling, right?
Yes.
decreases
Cooling
cardiac
of
output
blood.
and
So
decreases
this,
preload.
okay, cooling of blood. So this lead to decrease preload. Decrease
Preload.
preload mean decrease cardiac output. Decrease cardiac
Decrease
output
venous.
mean decrease blood pressure. So this is a
Yes.
transient. So when the blood pressure is decreased, it will activate the baroreceptor reflex. And what does the baroreceptor reflex do? It will inhibit the parasympathetic activity and activate the sympathetic activity. So in this way, baroreceptor reflex maintain our blood pressure when the person suddenly change his her position from sitting or lying to standing position. So this is a physiology, right?
Yes,
So what happened in the postural hypotension? Postural hypotension is basically this reflex is not intact or impaired, right?
Yes.
Due to the multiple causes. Autonomic pathologies like in diabetes. So what happened in postural hypotension? The patient does not maintain their blood pressure because of impaired of this reflex, right?
Yes.
Okay. One more application regarding, can anybody tell me the formula of the cerebral perfusion pressure? What is the formula of the cerebral perfusion pressure? Cerebral perfusion pressure is equal to mean arterial pressure minus intracranial pressure, right?
Yes.
So this is a high yield concept. So cerebral perfusion pressure is dependent on the gradient between mean arterial pressure and intracranial pressure. So mean arterial pressure is important for the perfusion of the vital organ, and cerebral perfusion pressure is important for brain perfusion, right?
Yes.
Brain perfusion, and this is vital organ perfusion. So if there is any condition that leads to increase intracranial pressure, right? Increase intracranial pressure. So cerebral perfusion pressure is uh, is mainly
Decreased.
dependent on the mean arterial pressure. So cerebral perfusion pressure is decreased, right? When intracranial
Yes.
pressure is increased. So body normally do a response that it will increase the mean arterial pressure as well, right? So this
Yes.
reflex is known as a Cushing reflex. So Cushing reflex
Yes.
is initiated by Cushing reflex. This reflex is
Yes.
initiated by increase intracranial pressure. So increase
Yes.
intracranial pressure lead to increase mean arterial pressure. So mean arterial pressure is temporary increase in mean arterial pressure to maintain the cerebral perfusion, right?
Yes.
So what happens? So Cushing reflex are triad, represent by three things, and that is a very high yield. Can anybody tell me the Cushing triad or Cushing reflex?
Yes,
Three components:
hypertension,
hypertension,
hypertension, bradycardia, and
bradycardia,
respiratory depression.
respiratory
Well,
depression. And what is the stimulus of this Cushing reflex?
uh,
Increased ICP.
increase,
Increase intracranial pressure.
yes.
Okay, so what is the role of therapeutic hyperventilation in increase intracranial pressure? Does therapeutic hyperventilation decrease cerebral edema or intracranial pressure? Therapeutic hyperventilation. Rock.
Yes.
Therapeutic hyperventilation. So therapeutic hyperventilation, what does it do?
Well, yeah, you're going to blow off carbon dioxide.
Yes,
So,
absolutely right. So So
Yes.
blow of the carbon dioxide, so the partial pressure of the carbon dioxide will decrease, right?
Decrease. Yes.
So the partial
Yes.
pressure of the carbon dioxide decrease. It will lead to the vasoconstriction. Why it will lead to the vasoconstriction? Because normally increased concentration of the carbon dioxide lead to the vasodilation, right?
Right.
So this vasoconstriction lead to decreased cerebral blood flow. Cerebral blood flow. When the cerebral blood flow is decreased, it will lead to the decreased intracranial pressure. So this is sometimes a temporary temporary treatment for the patient who has increased intracranial pressure due to the stroke, right?
Right.
So everybody has idea what is the Cushing reflex, what is the baroreceptor reflex, what is the postural hypertension, right? And what is cerebral perfusion pressure, right?
Yes.
Yes.